Okay, if you have a low back pain or some low back issues where you've got some stiffness, some tightness, you get sharp pains once in a while, what I would first of all recommend doing is walk, walk, walk. And if you are going to walk, consider a treadmill on a flat incline, or if you walk outside, try to limit the inclines that you're going up, because sometimes that incline you bend forward a little bit as you're going uphill, which will then exacerbate or make that low back pain potentially worse. So walk, 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 preferably on a flat surface. And again, if you're out hiking, you don't necessarily have a flat, smooth surface, but try to stay on fairly level surfaces so that, as I said, you're not going uphill. Some other things to consider. Here is an exercise you can do to potentially alleviate or help with some of the pain and also get some circulation in the low back region. This is just a hip extension on your stomach on the floor. Put your chin on your hands, just rest that head on the hands, and you're just going straight leg up and down. Now it'll flex your glute, your hamstring, and your low back. You want to do it on both sides. Keep your legs straight. Probably want to point the toes, or not towards you, but the other direction. You don't even have to point, just keep the foot relaxed somewhat and focus on the low back, glute, and hamstring. So that's a hip extension on your stomach on the floor. Another activity you can do is a what I call a trunk rotation, where your feet are together and you're rotating back and forth as far as you comfortably can with the arms out wide or at your sides, wherever you need to keep some stability. Now, if this is painful or the previous exercise is too painful, don't do it. But if you've got manageable pain and you can work through it, get some circulation in that low back area, that will potentially be beneficial for you. And then to make this one a little more intense, you lift the feet off the floor and rotate back and forth. And you may feel your vertebrae popping or crunching, or as long as you don't have pain, you're okay. But what we're trying to do is increase circulation in that low back region to help alleviate some of that soreness and hopefully make you feel a little better sooner. The worst thing you can do is sit around and not do anything, lay around on your back and not do anything, or sit in your chair all day hoping that things are going to get better. It's best to move, 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 and as I said, the walking will probably be the best thing for you, but these activities that we're doing so far will be very beneficial. Back to the on your back on the floor. Here's another thing you can do as well, pulling both knees towards the chest. If you can do that, pull it and just hold it as far as you comfortably can. I'd recommend pulling underneath the knees, just because you can get a little better leverage. Plus, when you push down this direction, it's a little harder on the knee joint. It may not be for some people, but I would recommend if you can just loop your wrists underneath the knees and just pull up nice and easy, knees to the chest. That might provide a nice, good stretch for that low back region. Again, another thing you can do to help stretch that back and maybe potentially ease some soreness that you might be experiencing, go with both legs out in front of you and reach forward nice and easy. Just kind of walk your fingers down your legs towards your toes. Do the best that you can. If you can't reach your toes, that's fine. Just reach as far as you comfortably can. But take yourself down as far as you comfortably can, and you should feel a stretch in that lower back region, the lumbar region. So reaching forward nice and easy, okay? Another stretch you can do, which might be too extreme for a lot of people, is stacking the heel on top of the toes. This one is, a lot of people will feel pretty intensely behind the knee and also in the hamstring of the leg that's propped up. You might feel it in this hamstring down below as well. But you try to take your head down towards the knee, or again, if your flexibility is not there, just reach forward nice and easy. and try to get both sides. This may or may not work for some people going down in this position. There might be a little bit too much torque on the low back region. Again, you're going to have to decide whether the pain is worth it to you and if it's too extreme. But if you get a nice little bit of a pull, not too intense, but enough to where you feel like you're gaining or alleviating some of the pain, or working the area and getting a little bit of circulation in that low back region, just work on these little stretches. I would not recommend trying to stretch your back out while you're standing up. It's always best to do it with your hips on the floor and you're not putting that extreme pressure on the vertebrae by bending forward. So it's always best to touch your toes while you're bending forward, seated on the floor, versus doing this while you're standing. One last thing I'll show you is, if you can, pull both feet in, heel to heel. Pull them in as far as you comfortably can, and try to just pull yourself forward. Some people can't reach their toes to do this. If you can grab your ankles and pull yourself forward, or grab onto the toes and pull yourself forward, this will stretch that low back region as well. So another stretch to potentially ease some of that pain. Again, some of these may not work for you, but these are all options if you're trying to get through some stiffness, some soreness, some pain that you're dealing with. But back to my original statement, walk, walk, walk. That's one of the best things you can do for yourself if you're having low back issues.